see.
What?
So, this is gonna be the spine of the scapula. So if someone was doing this with their arms, you'd see this going on with their scapula. Floating over the rib cage, the posterior aspect of the rib cage. These are gonna be the glenoid cavities. They're gonna be projecting laterally to articulate with the head of the humeruses. Humeri? I'm not really sure what the plural is of that. But this is the suprascapular fossa. And these are the supraspinous fossa, infraspinous fossa. Here. Here are the acromion. So here's an acromion, here's an acromion. And then from a lateral view, you can see the glenoid fossa here. Here is the coracoid process. Kind of looks like the beak of a crow. Coracoid process. This is the acromion.
Yeah.
And this is the suprascapular notch. The suprascapular notch right here. All right, the humerus. So on the humerus, we can see here the turn the light just a little bit.
You didn't. How do you really feel about this? What is this?
There's going to be the anatomical neck surrounding that, and then the surgical neck, which will be where the humerus is frequently broken.
Below the surgery?
Yep, all right here at the surgical
In
neck.
surgery or just in general?
I think they call it the surgical neck because maybe
It needs
sometimes
surgery.
surgery needs to be done to
It needs surgery to
To fix it.
articulate the bone, but it frequently breaks at the surgical neck. This is the greater tubercle, and this is the lesser tubercle. And in between those two is going to be the intertubercular groove, or the intertubercular sulcus.
So
I'm
easy
like
to see.
turning.
It's just a hilarious
Entire
structure.
thing.
Where is he pointing at? Right here?
But that is the proximal end of the humerus. At the distal end, you can see the trochlea here and the capitulum. And all of this is a condyle, an articular surface. So, the ulna is going to articulate with the trochlea of the distal end of the humerus like so. You can see here the trochlear notch of the ulna, as well as the olecranon process and the coronoid process. So when the ulna articulates with the trochlea of the distal end of the humerus, you'll see the coronoid process inserting into the coronoid fossa, like so. And from a posterior view, you can see the olecranon process of the ulna articulating into the olecranon fossa on the posterior aspect of the distal end of the humerus. So this is the olecranon fossa here. Articulating like so. The head of the radius going to articulate with the capitulum, like so. And the head of the radius is also going to pivot, because it's a pivot joint, at the radial notch on the ulna, which you can see right here. So the head of the radius articulates with the radial notch, and when pronation occurs, the radius will move like so over the ulna during pronation. So that is pronation, and that is supination. And at the distal end of both the radius and the ulna, you can see the styloid processes. So this is the styloid process of the ulna, and this is the styloid process of the radius. So on your own appendage, you can feel the styloid process of the radius here, and the styloid process of the ulna there. You can palpate them. Okay, the hand. So, for the metacarpals, which are the wrist bones, there's that mnemonic that we went over, which is say loudly to Pan, time to come home. So say, starting at the proximal row, laterally, say loud to Pan, and then to the distal row laterally, time to come home. So scaphoid, say, loudly, lunate, to triquetrum, Pan, pisiform, which is on top of triquetrum here. Time, trapezium, to trapezoid, come, capitate, and home, hammy. So scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate for the metacarpals. Sorry, carpals. These are the metacarpals. So metacarpal 1, 2, 3, 4, and 5. And then for the phalanges, for digit 1, there's just going to be a proximal and a distal. But for digits 2 through 5, there's going to be a proximal, a middle, and a distal. So if I put a tag here, what would you say?
4 middle flanging.
Fourth metacarpal.
Yeah, so middle phalanx of the 4th digit. Middle phalanx of the 4th digit. If I put a tag here,
Proximal phalanx of the first digit.
so proximal phalanx of the 1st digit. If I put a tag here,
Metacarpal.
metacarpal.
4th metacarpal. Alrighty. And now for the 3 bone. So this is the ischium.
Thank you.
This is the ischium. And this is the pelvis. So where these two come together is the
Pubic symphysis.
pubic symphysis right here. There'll be a disc of fibrocartilage in between it. But on the ilium, there are gonna be some spines. So this is the anterior superior iliac spine, because this is the buttonole, the ischium here. This is the anterior inferior iliac spine. This is the posterior superior iliac spine, the posterior inferior iliac spine, and the ischial spine, right here. This is the ischium, the ramus of the ischium, and the ramus of the pubis, this flat part. This is the obturator foramen, and this is the acetabulum, into which the head of the femur will articulate. Okay, so the femur. So if you see a femur and you're trying to decide if it's right or left, so it's sitting on the table and you're looking if it's right or left. Just remember that a lady never reveals her trochanters. So you gotta tuck those in the back. So this would be the left femur, because on the femur, there's a greater trochanter and a lesser trochanter right here. So that's the left femur. On the head of the femur is going to be the fovea capitis. That's going to be a place where ligaments will attach inside the acetabulum, like so. What kind of joint is this? Ball and socket. On the posterior aspect of the femur, you can see the linea aspera here. So this is the linea aspera. And then where the distal end of the femur will articulate with the proximal end of the tibia are the two condyles. So this is the medial condyle, and this is the lateral condyle. And then this is a facet right here. So for the tibia, I know this isn't the right one, and I'm going to tell you why. Because when the tibia articulates with the femur, there's going to be something called the medial malleolus on the tibia, and that's going to be right here. And so I needed that to be medial for it to be the medial malleolus, which it is. So I knew I needed a different one. So it's going to articulate like so. On the proximal end of the tibia, this is going to be the medial condyle, because you can see the medial malleolus here. So medial condyle, and this is the lateral condyle, which will articulate with the condyles on the femur.
Is this the left? This is the left. Right.
The fibula.
Right.
Or he's got the left. Let me see.
So,
Or I guess, yeah, I had it backwards. I was looking at you backwards. Or would it be?
I think it's the left.
I think it's the other
You have it right?
Yeah, we have the left.
left.
Because I'm looking at it, like, trying to see here where would my knee come out.
And so the fibula
It's always like this way is up.
is going to articulate below the knee joint at the proximal end. And the head of the fibula is rounder than the distal end of the fibula. The fibula is going to have a flatter distal end. And so it's going to articulate like so. And this distal end of the fibula is going to form the lateral malleolus right here. So that's going to be that bulge you can feel on the outer aspect of your ankle. The medial malleolus is what you can feel on the inner aspect of your ankle.
That's what we call the ankle bone, right?
Yeah.
I got my hip.
So the foot.
Does it sit like that?
So for the foot,
I think it's sit like that. I think we just have it like so. Okay. Is this the way it is? Or is it that? This is? I guess maybe because we have the other one.
we're gonna have the tarsal bones from here to here, the metatarsals, and the phalanges. So the mnemonic here is children that never march in line cry. So it goes calcaneus, talus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid. So calcaneus, talus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, cuboid. Metatarsal 1, 2, 3, 4, and 5. And then for the phalanges, the same theme is going to be found in the phalanges. So for the first digit, there's just a proximal phalanx and a distal phalanx. And then for digits 2 through 5, there's going to be a proximal phalanx, a middle phalanx, and a distal phalanx. So if I put a tag here, how would you document that?
Proximal phalanx.
Fourth.
Proximal phalanx of the 4th digit. This would be
Distal phalanx of the first digit.
the distal phalanx of the 1st digit. How about here?
Lateral.
It's kind of hard. It's hard if you have that mnemonic down. You have to kind of count it out. But yeah, that's going to be the lateral cuneiform here. All right. So now for the